This injury is called an anterior tibial stress fracture. The primary muscles affected by this injury are the tibialis anterior, gastrocnemius, and soleus, otherwise known as the calf muscles. This is an overload injury that occurs often in soccer players because they are constantly using their legs, including running, kicking, planting, and pivoting.
Place band around the ball of the foot and point toes forward, holding that position briefly, then relax. This exercise will work to strengthen the gastrocnemius using resistance and stretch the tibia. Have a partner place a band around top of the foot. Flex foot towards your body and hold briefly, then slowly lower your foot back to a relaxed position. This exercise will strengthen the tibialis anterior muscle and stretch the calf using resistance. Holding onto a steady surface, first lift the medial side of the foot up and out, then relax. You will then lift the lateral side of your foot toward the air. Alternate motions. The tibialis posterior and anterior muscles are worked by inverting the foot, and the fibularis and extensor digitorum longus muscles are worked to evert the foot. Put your foot against the wall and apply load by pushing foot against the wall. Hold the position for 5 to 7 seconds, then relax. This will activate muscle contraction and strengthen it. Begin by standing on one foot and hold balance for 20 to 30 seconds. You can always make this more difficult by closing your eyes to improve proprioception. Holding onto a steady surface, lift heels off the ground, and then return to rest. Make sure motion is slowed and controlled. This exercise contains both concentric and eccentric contractions that will strengthen the calf.
This first exercise is step-ups. Step-up strengthens the quads, hamstrings, and glutes to provide stability. To progress with this exercise, dumbbells or an Air-X can be used. Bridges work on strengthening the quads, hamstrings, tibialis anterior, glutes, and the deltoids. Be sure to inhale while raising the back and exhaling during relaxation. To progress this exercise, weight plates can be added to the hips. Lunges focuses on strengthening the quads, hamstrings, and glutes while using your core, calves, and the muscles in your back as stabilizers. Leg raises targets the strengthening of the iliopsoas, the pectineus sartorius, the rectus femoris, and the adductor longus. To progress with this exercise, a medicine ball can be added in between the feet. Side squats targets the glutes, quads, hamstrings, and the core. You can do these with or without a resistance band, and you can increase the resistance or use a Bosu ball to make this more challenging.
Today we have stage 3 of rehab program for a soccer player who has a tibial stress fracture. Here's just a ball being kicked against a wall. Here is a person, well, me, dribbling back and forth, maneuverability. Here is doing some mobility skills over a rope, so agility style stuff. And essentially this is just working them back into the sport so they can adjust to it, and as well as working muscles in the lower limbs, so the quads, hamstrings, glutes, calves, that kind of thing. And then this exercise here kind of just helps with getting those ankles back and being mobile and just really being able to move around as if you were actually on a soccer field.